Today we are going to look at the liquid portion of blood. That is what we call plasma. Remember that um, over half of the composition of blood is what is considered the plasma, the liquid portion of blood. About 45% of that is the erythrocytes, the red blood cells or the formed elements, and then 55% of that is the liquid portion, the plasma. The plasma part of water, dissolved proteins, sugar, waste, salts, and hormones. I'm sure we've all heard of edema. Maybe having grandma having some edema in her legs, or having some edema following a knee injury, edema in the ankle. Okay. Edema is the result of having too much fluid leaking out of blood vessels into tissues. Okay. Just kind of a little fun fact for you. And we're going to look at blood types. And some people know a decent amount of blood typing. Unfortunately, that was going to be a fun topic for us for this last quarter. We look at taking our blood type and determining that by pricking a little bit of blood onto a special card and looking at which of the solutions would make your blood clot, to look at the type. Some of you may already know your blood type, some of you may not. When we're looking at blood types, we talk about it just a little bit because we need to know about transfusions. And transfusions are where we take whole blood, which when we say whole blood, we mean both the cells, both the red blood cells and the plasma. Okay, and we use that to replace blood that's lost either after injury, during surgery, or in the cases of severe shock. Not too much before we kind of went on this little coronation. We had an athlete that had a little mishap and lost quite a bit of blood. He didn't really go into shock. He didn't lose that much blood, thankfully, but he lost a pretty decent amount of blood, and his coaches were quite concerned that he was going to be going into shock, but luckily he did not. When we're talking about blood types, there's four main types of blood that human blood falls into: A, B, AB, and O. Okay, and they're based on the types of the antigens on the red blood cells or the erythrocytes, and those antibodies that are found in each person's serum. This little chart shows us how the different types interact with one another, and what types of bloods will be received by other, or what types of blood cells others can receive. If that the blood type compatibility is important, because if blood is transfused and it's not compatible, then we have hemolysis that occurs. So if we look at hemolysis and we take hemo and we remember that that means blood, and lysis means breakdown or destruction, then the breakdown of red blood cells is what we call hemolysis. Another important type of blood, or a factor that's part of blood typing is the H factor. Okay, it doesn't really affect a person's health until they are pregnant. Its Rh factor is another antigen that's located on the surface of the erythrocytes. A person that is what we call Rh positive is a person that has that Rh antigen on their red blood cells. This picture on the right kind of shows what can happen if a um, woman is Rh negative, so she does not have the Rh antigen on her erythrocytes, and she conceives a Rh positive baby. Um, the first time that, or not the first time, rather, when a child is born, there's blood shared, swapped, mixed. Okay. Um, Other times when that can occur would be through an abortion, through a miscarriage, or through childbirth, that those two blood types can mix. So, the first time that an Rh negative woman has one of those circumstances and has a Rh positive baby, it's okay. Once those two types mix, then the subsequent abortions, miscarriages, childbirth can cause major issues um, for the baby. Basically, the mother's blood starts to develop antibodies against um, those Rh positive blood cells, and essentially break down the baby's blood. Um, it's not all doom and gloom with this. Um, I myself am Rh negative, and after we had our first miscarriage and they tested my blood, they told us that I was Rh negative, and Clay was tested and he's Rh positive. So we very easily could have Rh positive babies. And so following that first miscarriage, anytime I was pregnant, I had to take some shots um, to prevent my body rejecting the baby. Um, 2 or 3 shots, I think, if I can remember right, for each pregnancy, and then um, one right after I delivered each of the kids, and it took care of everything. So it's not the end of the world if you are Rh negative, for you ladies, or if um, any of you guys are Rh positive and have an Rh negative wife someday. It's just something you want to know so that you can have those shots and prevent any future complications. Blood clotting is what we call coagulation, and the blood or the platelets just become really sticky and collect at different sites of injury. That's important because if they don't become sticky and collect, then the blood doesn't clot, and we continue to lose blood. This process of blood clotting typically occurs within 15 minutes of injury. I think that's not anything earth shattering or something surprising for you. Um, I think most of the time, if any of us have bloody nose or a small cut or something, and we were bleeding for more than 15 minutes, that we would start to get alarmed. Warfarin is just another name for Coumadin. It varies based on the branding, but it's essentially the same drug. But it's a drug given to patients to help prevent the formation of clots. We're going to stop there today. And next time we're going to look at a few vocab words. We're going to cut down our vocab list pretty significantly since we're going to be out of the classroom. But we'll start looking at some of those vocab words next time.